You have questions?
What's
Yes.
next for healthcare in the economy? Any changes or attempts to impacting Obamacare? What's your answer?
You want me to tell you about what should happen? What should happen at the federal level is exactly what happened here in Massachusetts. We passed health care back in 2006, and we did it on a bipartisan basis, and we got part of it in place, and then we made some changes, and then we made some more changes, and we tried to make it a little better. And we learned some, and then we made some more changes. Healthcare is complex, even though Donald Trump didn't know that. Most of us here in Massachusetts knew that. But we worked together to keep improving it. For 7 years now, Democrats have had a healthcare bill that we originally built thinking this was one that would appeal to Republicans. We took Republican amendments on it. And then once we got it in place, all they did was say, repeal it, repeal it, repeal it. I would like to see us come together and make the Affordable Care Act better. I would like to see us follow through on our goals, and that is better health care for all of America at lower cost. But it's going to take all of us working together, and that means we've got to have some Republicans who are willing to try to make the Affordable Care Act better.
Senator, does that happen in a situation where Paul Ryan and the president are saying, hey, we're moving forward, we're moving on?
You got to ask Paul Ryan and the president. I mean, that's a political question. All I can tell you is that what we should be caring about is health care, its availability, its quality for everybody in this country. That's what we should be working on.
Senator, what's the first thing you would change to the ACA? And then also, similarly, if the Republicans came across the aisle to work on the ACA, is there anything you'd be willing to cross the aisle to if they came forward with some sort of health care legislation?
Oh, look, there are lots of things we could do to the Affordable Care Act. A lot of it is down in the weeds because we've got the basic structure. But for example, we could do a lot more around bundled payments, which is a way to let healthcare providers make their own decisions about where they want to cut costs, but always to measure it against whether they're getting better outcomes. We've experimented with that in Massachusetts. We've proven that there are actual savings that could come from that and better healthcare outcomes. That's just one example. Our docs and healthcare providers and community health centers here in Massachusetts, they have a zillion good ideas, but we got to have a willing partner on the other side.
Senator, you previously expressed support for single-payer and more progressive forms of health care. Can you delve into that a little bit more?
Look, you know, if the Republicans are not going to help us improve the Affordable Care Act, then if the time comes that we're going to have to tear this down and start over again, I think we have to start with all options on the table. Because ultimately, we have to keep driving toward the same goal, and that is better healthcare outcomes at lower costs. And there are ways to do that. I mean, we just have to follow them.
Senator Paul Ryan and the president today both said that, okay, if ACA continues, if the Affordable Care Act continues, the system will crumble. Do you think if nothing is done in a short period of time that that's true?
So let's be real clear. We're not talking about if nothing has done. Donald Trump has already actively worked to try to make Obamacare fail. I mean, that has been his goal. And the example of that was right after he took office, in the last weeks of sign-up for the Affordable Care Act, he withdrew the public outreach for it. Why? So that fewer people would actually get health insurance and sign on to the system and help bring down the costs overall. You know, there's a lot that Donald Trump can do to try to tank Obamacare. So what this is going to come down to is, what is your real goal, Donald Trump? Is your real goal to try to help Americans get the best health care they can, in which case he will support the Affordable Care Act. But if his real goal is just to try to score political points, then what he's going to do is every chance he gets try to knock the legs out from underneath the Affordable Care Act and bring it down. That is not good for the American people.
Last question.
On Russia, if you get your goal, nonpartisan head, independent commission.
Special prosecutor, independent commission.
Exactly. Where do you find a nonpartisan person?
So, look,
Do you have a name?
yeah, it's not about specific names. There are a lot of prosecutors out there who have shown their independence. You know, can I just say, I actually had a little bit of experience with this. My first big trip down to Washington was right after the financial crisis, when I headed up the Congressional Oversight Committee. And really, I chewed pretty hard, not just on the Wall Street banks, but also many times on the people in my own party. I was there to be an independent voice, and that was my job, and that was what I did. I think there are a lot of people who get out there and follow the way across Freedom Falls, but it's got to be their number one job. Not getting reelected, not mugging through cameras, but get out there and do a truly independent investigation for which that person did their best to get to the bottom of a very, very troubling issue.
Thanks, everybody.
Thank you.
Okay, I'm gonna get back over to you.